Alert for parents right now. Poison Control Center hotlines have seen a 400% increase in calls related to kids drinking hand sanitizer. It's filled with alcohol, of course, ranging from 45% to 95% depending on the brand, which means that kids who drink it, they're ending up drunk.
Our chief health editor, Dr. Partha NandiÂ, is here right now. Thank you for joining us today. Now, this is a real problem. We're not just kidding around. The kids are drinking hand sanitizer.
Yeah, and as Joanne pointed out, it's 400% increase. And so the young kids like it because it tastes good, and the older kids are trying to get drunk on it. So it's a big problem. It really is.
I can't imagine that it would taste good. You know what I mean? Now, you smell it on your hands, and in some cases, though, they're putting scent in it.
They're putting
so
scent
maybe
in
it
it.
smells
Yeah, well, the kid, they had a 6-year-old in Atlanta that it got in, and her blood alcohol level was twice normal, and she said it tasted good. Plus, she had it, yeah. So we got to be careful. That's an important problem.
What else is in hand sanitizer besides alcohol? I mean, there are antibiotic kind of things, or
well, the alcohol itself is enough to kill it. So it's unlike other, unlike taking a drink, which is much less in percentage. I mean, you can have up to 95% of the actual hand sanitizer alcohol. It doesn't take a lot to get these kids drunk. So if I was a parent, I would say, listen, you know what? I would tell them the truth. There is alcohol in it, because people say, am I going to then have the teenagers say, I'm going to try it? I would tell them it could kill them. I mean, not that that always works, but tell them that it is so much more than what your average drink has that you could die from it. And if you have kids that taste it, call the Poison Control Center.
Sure.
And if they have any slurred speech, any confusion, take them to the ER. Don't wait.
Okay.
This is getting a lot of controversy. Over the weekend, the Daily Mail published an article online saying basically Alzheimer's is contagious. The study claims you can catch it from blood transfusions, operations, and dental work.
Wow. All right, Dr. Nandi, this has been debunked, hasn't it?
Yeah, it has. It just freaked people out. This is all people need, is to not have a reason to have blood transfusion or give blood. So totally been debunked. But important enough is that you need to know that Alzheimer's is a problem, and if you have a patient or a loved one, one of the main things is that you start to forget recent events. So, for example, I tell Joanne and Stephen, what did I just talk about? Time to take me to the doctor, or at least get some help. Also, when it starts affecting your life. So, for example, you go to a place and that you're familiar with, you don't know where you are, or you can't solve a problem. So, Stephen tells me that they're talking about something that's a big issue, and I don't know what. And you say, Dr. NandiÂ, I want you to talk about it. I don't know what to do.
Right.
Those are the symptoms, and then you got to take them to the doctor, because here's the key about Alzheimer's: you can't go backwards, but you can hopefully prevent it from going forwards.
Not contagious, though.
Yeah, good
Not
advice.
contagious,
Yeah,
no.
Good. This is fascinating here. Eating a Mediterranean diet can reduce your risk of breast cancer. Researchers say women who had 4 tablespoons per day of extra virgin olive oil have a 68% lower risk of developing breast cancer compared to women on a low-fat diet.
All right, so first of all, what is the Mediterranean diet besides olive oil?
So you have nuts and then plant-based foods. I love anything that shows the Mediterranean diet is positive. I love it. Why? Because it's plant-based foods. It's having poultry and fish, a couple times a week. And here's the reason why it works so well, is that what you're doing is you're putting good fats in. Instead of having, a steak, you're saying I'll put good fats in with nuts and fish. So I think it's really excellent. I think if you can incorporate in your diet, it will do well. It decreases heart disease. Also, people have shown that it decreases the incidence of cancer as well as Alzheimer's.
All right, so those are the big things. And also, I would just assume eating like that helps you keep your weight down.
Yeah, plant-based foods. The key is plant-based foods.
Is that important?
How about coffee cakes? Is that on the
I don't
Mediterranean
think so.
diet?
They are organic and lower fat.
The big X. The big X.
When you talk to patients and they want to know more about this stuff, is there a book or other resources or what?
I like the MayoClinic.org. I like that, and then the National Institutes of Health. If you go to either one of those sites, you'll get good non-commercial information. So I think it's quick, and it gives you a nice idea what to do.
All right, you may want to stand up for this news right here, because a growing amount of research suggests just standing, even if you don't even move around or anything, can have health benefits. According to researchers in Australia, people who spent more time standing had lower levels of blood sugar and cholesterol. And I've got the Apple Watch, which tells me to stand like once an hour.
Does it really?
Yeah, it does. It tells me stand up.
Did you program that?
No,
or did it
it's part of the
how
software.
I'm sure he did.
Yeah,
so here's the thing, if you stand, the big muscles in your body apparently release fat-burning enzymes, so that's great. And also, you burn more calories. The other thing is that you circulate your body, and so it's now shown that sitting is the new smoking, right? So if you stand up, it helps. people say, like, I can't sit, I can't do what Stephen's doing and Joanne, I can't stand on my job. So what I say is stand up every 20 minutes if you can. At your desk, even that will help. And that doesn't mean that it's a pass.
Go to the gym.
You should still go to the gym. Remember, 20 to 30 minutes of activity 3 times a week is super important. So just because you stand, it's not enough.
And maybe talk to your boss about a standing station. We actually have a couple in the newsroom here that the table raises and lowers, has a computer terminal so people can stand up and do the work.
There are people even, work on a treadmill.
I know. We've talked about that.
I feel like I'm on a treadmill.
Yeah.
Thank you, Dr. NandiÂ. Thank you so much for joining us for the Now Detroit.
Yeah, Action News.